Choice Home Care and Hospice present Choices to Benefit the Aging with your host, Joe Urrutia.
Welcome to Choices to Benefit the Aging. I'm Joe Urrutia, Community Senior Service Coordinator for Choice Hospice and Home Health. Today's guest, we have Dr. Eric Spear, and our topic for the week is, for the month, I apologize, is Brain Injury Awareness Month. And we would like to welcome our guest again, Dr. Eric Spear, to our program.
Thank you.
Welcome, Dr. Spears. Doctor, can you please give the audience a brief background of your practice?
Mm-hmm. I'm a physiatrist, or physiatrist, depending on where in the country you are. It's physical medicine and rehabilitation. It's actually one of the smallest specialties in medicine. But what we do is we take care of people's quality of life. The focus is more on quality and not quantity. So we work with people with different kinds of disabilities in order to rebuild their lives. And my personal practice here in El Paso is at 1393 George Dieter, Suite A. And what we do there is see patients both in the clinic, but we'll also go to different hospitals and manage different rehab hospitals to take care of patients with everything from a hip fracture to brain injury, which we're talking about today, to cerebral palsy, multiple sclerosis, anything that really makes it difficult for someone to go back home straight away. I grew up in El Paso, and then I went to school between Austin for college, and then I went to Houston for medical school. I went to Yale in Connecticut for my medicine training, and then went back to Baylor in Houston for physical medicine and rehabilitation, which is actually the hospital that took care of Gabriella Giffords. And at that point, I could have gone anywhere in the country, but I really wanted to come to a place where I could give back to the community that I came from. Sort of put a cork in the brain drain and really give something back to the place that I grew up. And so that's what brought me back, and ever since then we've been building different resources to really serve the entire spectrum of care in rehab and more specifically with my interest in brain injury. And
with that, you also are the medical director for Mentis Neuro Rehab. Mm-hmm. What is Mentis Neuro Rehab?
Mentis Neuro Rehabilitation is a facility that is a little bit more like a school than a rehab hospital. It's where people go to live and rebuild their lives after debilitating injuries. And it may be someone who's had an injury that is so significant that the goal is to be able to get them home safely so that they're not a danger to themselves and they can be left alone for periods of time, to getting, a banker, a doctor, a lawyer back to work full time and safely after a stroke or a traumatic injury. And we've had people who have been in any kind of situation, from having a gunshot wound through the head to having an infection of the brain to being wrecked in their semi and being torn apart top to bottom. And the job of rebuilding lives is not just something that takes place in the hospital. It's something that requires everything from vocational services to psychological services to community services to meeting with families and helping to rebuild the social structure that they come from.
And they're located at 1831 Murchison Drive, and that is where there's an assisted living adjacent to Mentis, and that is 1831 Murchison Drive, which is their number at Mentis is area code 915-351-4441. I'm going to go back into as a brain injury what exactly is a brain injury?
A brain injury is any kind of injury that occurs within the brain, and there are different ways of splitting it up to understand it better. In some countries, in New Zealand and Australia, for example, they split it into acute brain injury, is a type of acquired, and then a chronic injury. So an example of a chronic injury may be Parkinson's or Alzheimer's dementia, And an example of an acute injury would be a gunshot wound to the head or an encephalitis from an infection.
Brain injury is referred as a silent epidemic. And what does that mean by silent epidemic?
I actually Googled silent epidemic recently, and there are all kinds of things that pop up. But the Brain Injury Association and various different advocacy groups have described it as a silent epidemic because people are so unaware of it. A lot of people, for example, are coming back from the war after having traumatic injuries and PTSD, and nobody is able to look at them and see that there's an injury. And so it's frustrating and disabling for these people to be in a position where they can't explain what's going on, but they know their life isn't going back together like it should, and they're not able to do the things that they used to be able to do. If you look at the statistics for what is out there that's causing major types of morbidity and mortality in the country, as much as 2% of the entire country is living with a permanent disability associated with brain injury. There are approximately 1.5 million people a year that are disabled or injured and affected by strokes and head injuries of various types, both types of acquired brain injuries. It dwarfs the second place, which is cancer and then heart disease, which are actually relatively minor in terms of their morbidity. The reason that cancer and heart disease have such a big predominance is because they're so drastic, they're so obvious, and because those are the things that are out there killing people. You know, it's a lot scarier and a lot more likely for someone who has a heart attack to rush to the emergency room because of the pain. But it's a lot less likely to be an issue in someone who may have some weakness on the right side of their body and be suffering from a stroke, even though it's just as disabling, just as important.
And that's where Mentis comes in, the rehabilitation, where your expertise are to assist these patients, I assume, for to rehab them and get them to a better quality of life, correct?
And to get them back home, yes.
Back home.
I mean, one of the issues there is that a lot of the injuries that occur go unnoticed. You know, there will be, you know, mom or grandma will have some weakness on the right side of the body, and people will ignore it for a few days instead of calling 911 and getting them to the emergency room as they should. And so there won't be anything that can be done, but their disability or their impairment isn't so significant that they require a lot of additional help or rehab. Mentis is a place that was designed for that small fraction of the population whose lives have been completely disassembled by their injury, where the deficits are so severe and the destruction to their social structure is so significant that they need a lot more assistance before they get to the point where they can put their lives and their families' lives back together.
I want to talk about the brain now and what is it made out of, and that's one of the questions I made of.
Right.
Can you please explain that to us and what it's made of?
I was just thinking about this earlier in a way to kind of how to explain what the brain is structured like, and I described it a little bit like an egg.
An egg, yes.
The egg has a hard shell, like the skull, that protects the outside and gives it a little bit of stability. And then it has a little membrane inside of that that really makes sure that nothing can get in and out of the yolk and the egg white that's actually inside of it. And that's actually protects it from infections or other issues. And then on the inside you have a fluid that the entire brain and spinal cord is bathed in called the cerebral spinal fluid. And then the brain sits inside of that, kind of buoyant. So it has a fair amount of protection around it. But it's certainly susceptible to all kinds of injuries.
And there is different levels of brain injuries, correct?
Certainly.
And what are the levels?
There's different ways that it's categorized depending on the type of injury. So if someone is having a stroke, there's actually a scale with which they explain their deficits in order to decide whether it's likely to be a stroke in order to pursue getting a CT scan and the treatment for a stroke. If it's a blunt injury or a traumatic injury like a gunshot wound or a fall to the ground, Then they look at how confused or disoriented the person is, and they use something called the Glasgow Coma Scale. And then over time, depending on where they are in their stage of recovery, it's looked at in different ways. So there's a Glasgow Coma Scale, but then there's also the period of time that they're in a coma, and then the period of time where they're in an amnestic state. And that can be expanded depending on the injury. If I'm a high school football player and I have my bell rung, as they say, I may be briefly unconscious for a second and then have a loss of memory for 30 seconds or so and then be relatively confused for several hours. Whereas if I'm in a car accident and I have a significant blow to my head, I could be in a coma for a period of a week and be in an amnestic state where I don't remember anything that happens for 3 or 4 weeks, and then be relatively confused and disoriented for the better part of a year. And that's one of the ways that they describe one aspect of a brain injury that's related to diffuse axonal injury, which is that microscopic injury that happens from a quick blow to the head.
Gabriella Gifford, what type of injury did she have? And please, there was a lot of media coverage regarding Gabriella Gifford's injury. And please explain to the to our audience who is Gabriella Gifford and the type of injury that she received.
Giffords was a congressman in Arizona, and she was injured by a bullet. The blow to the head entered the skull near the eye, and it exited. And that type of penetrating injury is a completely different issue than what we were talking about before. She initially received her treatment in Arizona, and then was transported to Herman Hospital in Houston, Texas, where she received additional treatment. There she was stabilized and then transferred to the Institute for Rehabilitation and Research in Houston, Texas, in the Medical Center for Rehabilitative Care. And that is a rehab hospital. In El Paso there are a couple of rehab hospitals as well. The treatment that she got there was from physiatrists like myself. In fact, that's one of the places where I trained, and her physician there was named Gerard Francisco. And the care that she got there was from an entire team of rehabilitation specialists who really came together to help her learn to speak again, learn to walk again, and learn to sing again. But also to look at all of the different aspects of her life, from being able to dress and bathe to being able to speak in front of in front of Congress again, as well as to communicate effectively with loved ones and deal with spiritual issues and emotional issues in that process of recovery. And so members of the team in that rehab setting are really geared towards addressing all of those issues of the quality of life and rebuilding one's life, and not just the quantity, not just treating the underlying. You
said something about members of that team. Injury. So which type of physicians are part of that team? So with a person with brain injury.
Right. When she in the spectrum of treatment, initially she would have been treated by an emergency room physician, and then she would have been treated with neurologists and neurosurgeons depending on the situation. And then once she is stabilized, then she's transported to a facility where she's cared for by a physician like myself who does physical medicine and rehabilitation. And that's where the majority of the rehabilitative process occurs. And then sometimes in that process, there's back and forth between the hospitals, or there's coordination of care between the treating physicians. For example, in her situation, she had to have a piece of her skull placed back in, and she had to have a shunt placed in order to decrease the expanding fluid in her brain, because there was a problem called hydrocephalus, where the brain gets crushed because the fluid that's created in the brain isn't able to get out. So in that period, she was transferred back to the hospital under the care of neurosurgery for the surgical intervention, and then transported back to the rehab hospital. So it's important that there's good communication and coordination of care, And it's important that the physiatrists or the physical medicine doctors that are caring for her are able to identify the hydrocephalus and treat it quickly so that it doesn't have the time to actually damage the brain further and cause more problems. You also have to keep an eye out for things like seizures and infections, and this is all done by a coordination of physicians depending on what problems arise.
Okay. Who is most at risk for brain injury? It's the kind of injury that sees no borders. No one is safe. The rich, the poor, the old, the young. But there is a distribution where there are peaks of people who are more susceptible to injury. The very young and the very old. Particularly with traumatic injuries. In a younger population, it tends to crowd around our late teens and early 20s, where people tend to be a little bit more risk-prone. And then in the very older populations where we begin to lose our balance or we don't have the safety awareness or other health concerns begin to get in the way, we're more susceptible to falls and head injuries. And then there's a small peak for the very, very young infants who are abused or fall or have injuries that are unexpected as well. How has the treatments over the past 30 years changed for a person with brain injuries?
There was an old saying in medicine that half of what you know in 5 years will be useless. And that is particularly true in brain injury because things have evolved so quickly in that industry that the way that we treat a patient now is different than it was 5, 10, 15 years ago. 30 years ago, there was no way to help someone who had a traumatic injury that caused swelling or bleeding in the brain. There was nothing that could be done. So if the patient was brought into the hospital, you couldn't do anything to prevent the brain from crushing itself as it began to swell. And over the last 20 years or so, they've been able to get a better feel for what's going on in the brain. In the 70s, they had the CT scan. It wasn't until the 80s and 90s that they really began to use MRI effectively. And neurosurgeons wouldn't have dared take a big chunk of the skull off to save someone's life. And when they first started doing that, it was considered very experimental. And most people who they did it to did die. But that was in a population of people who were so at risk for death that whether you did nothing or something, in all likelihood, they were going to die. And now we're able to safely take a piece of someone's skull off, a large piece of someone's skull off, so that their brain has the space to expand. And then when it begins to contract again, we can put the skull back on and let them get better. I had a patient once before who was a young teenager who was involved in an accident, who suffered an injury so badly that the surgical team that was caring for him was sure that he was going to be dead. They took a large chunk of his skull off, and they were so sure that he would not survive the event that they didn't even bother in the emergency procedure to save the skull that they took off.
Okay.
Within a few weeks, he was walking, talking. We sent him to Houston, actually. And he was completely independent and ready to go back to school within a few months. And what we had to do is we had to find a place where they could refabricate a polymer using an MRI to mimic the shape of his brain and then recap it and sew his skin back over it so that he had a skull again, since they didn't have his skull from before. And now you wouldn't know anything had happened to him.
Dr. Spear, I want to go over, if you can tell me the difference between a brain injury and a stroke. Is there a difference? A
brain injury is a type of stroke.
Okay.
So both brain injuries, the traumatic brain injuries, and stroke-related injuries are types of acquired brain injuries. So before we talked about the long-term injuries and the short-term acquired injuries. Well, within acquired injury, you have traumatic injuries and you have strokes. Strokes can occur for a variety of reasons. It could be because a vessel in the brain bursts and causes a bleed. It could be because a clot goes into the brain and occludes a vessel and causes everything downstream of that vessel to die. And that's what we usually associate with strokes that people suffer from that show up in the hospital with half of their body weak or confused or sedated. A traumatic injury is any kind of injury that causes an external force on the brain to result in damage within the structures of the brain. And those are also highly variable. We talked about Gabriella Giffords, where there was a bullet through the skull. And then we also talked a little bit about traumatic injuries that are a blow blunt to the head, causing the head to bounce around in the skull like a football player. And one thing that we didn't talk about, but is also interesting, is explosive injuries, like the kind that our veterans returning from Iran and Iraq have suffered from, where you have explosive supersonic waves moving through someone, causing expansion and contraction of different structures within their brain and causing stress to them and injury that is a completely different type of injury that we're still learning about now.
I want to talk about Natasha Richardson, which she was involved in a skiing accident. I understand that she refused treatment and she died shortly after. I mean, what made her brain injury so fatal?
Natasha Richardson was skiing in Canada, and she fell down with her ski instructor. She struck the side of her head and didn't really think that much of it. The ski instructor insisted that she go receive treatment. They went to the infirmary, and she said that she was fine, and she refused treatment and signed out against medical advice. The emergency vehicle that was coming was turned around and had never seen her, and they decided to go back to the hotel room without any treatment. Well, she had the type of injury that's called an epidural hematoma. So in the egg analogy, that would be like having a bleed between the shell of the brain and that thin membrane that covers it. So it's on the very outside, just underneath the skull, and just outside of the meninges that covers and protects the brain. There are lots of big vessels that run through that area, and the middle meningeal artery is under quite a bit of pressure because it has just come out of the heart. It's an artery, and it filled those areas of the brain, that little area pocket of the brain, with blood, with such pressure because it was an artery that it crushed the brain. So by the time they could have gotten her help or done anything about it, her brain had already hemorrhaged through the area at the base of the skull into where the spinal cord goes, and she was dead, and there was nothing that could be done about it at that point.
So is every brain injury an emergency? Every
brain injury needs to be looked at very seriously. Something as subtle as a small hit to the head can cause an injury like that can be deadly, and you wouldn't even know it. And then there are some injuries that are hellaciously painful that may not require any surgical intervention. Okay. But if there's any question at all whether something should be done, then go straight to the emergency room or call 911. And with strokes in particular, it's very important to call 911 because there is a period of time where the patient can receive an intervention that can be life-saving. And if you don't get to the hospital within an hour or so of that time, or you don't get that intervention within 3 to 6 hours of the first signs and symptoms of a stroke, then you can lose the opportunity for as significant of a recovery as you would get if you had treated it as an emergency.
Dr. Spear, I want to talk now about concussions. Please give me the definition, and what are the signs and symptoms of a concussion?
A concussion is also sometimes referred to as a mild brain injury, and depending on what you read or who you talk to, they're described slightly differently. But a concussion is any blow to the head that causes any amount of deficit. And so if you hit your head and you are confused even for a moment, it causes any derangement of your sensorium, your perceptions and level of alertness, then you've had a concussion. And some people who've had concussions may have no symptoms after a few hours or a few days. And some people who've had concussions, even relatively minor brain injuries, can go on to have deficits for the remainder of their lives.
So if I suspect somebody has had a concussion, what should I do next, or what should people do next if they...
You should either present to the emergency room or call 911, or call your physician right away in order to get some advice on how to move forward. But they should not be treated lightly. In situations where you have games being played, such as intramural sports, there's often a trainer at the side of the field who's trained to assess those injuries and decide how to move forward with them.
I want to ask you about seizures, and also how does that affect the brain with brain injuries? And the other question is, can brain injuries cause dementia?
Mm-hmm. With seizures, what happens is the exposure of the brain tissues sometimes, particularly when there's a penetrating injury or blood on the surface of the brain, there's a higher risk for having seizures. And so brain injury can cause seizures, but long-term seizures from a brain injury is relatively rare. It's extremely rare when there's no blood on the brain and no penetrating component and no evidence of infection, but the risk does still exist. And seizures can present in many ways, from convulsive episodes to strange smells in the mouth. The
dementia?
Dementia is also a factor with brain injury, in that any injury to the brain over the long term can cause changes in our thinking and our processing. And that is dementia. Dementia is anything that affects our ability to remember things and be independent, and affects our ability to think.
Can a person completely recover from a brain injury?
It's possible to completely recover, in the sense that if you have a relatively mild brain injury, you may not notice many deficits as time goes on. But most brain injuries, particularly most severe brain injuries, are best looked at as a medical illness that will continually come back to affect your livelihood and your long-term independence. Because there are so many things that can happen because of the brain injury, because the dementia can happen earlier, because of things like hydrocephalus and seizures, it really requires a long-term supervision from a physician in most cases.
We're going to be wrapping up the program, and my last question is, if I want to learn more about brain injury, where can I go to find information?
There's actually a local chapter of the Brain Injury Association, and they meet at Mentis on Wednesdays, Tuesdays, the first Tuesday of the month, but you can call Mentis and find out more about that.
And that number I have
It's actually a different Tuesday, but it's once a month, and they hold the meetings at Mentis. And then there's a state Brain Injury Association and a National Brain Injury Association. And the National Brain Injury Association has a website. It's biausa.org.
biausa.org. And if they want more information for these type of information on brain injuries, which is again Mentis, their location is 1831 Murchison Drive, Suite C, and their phone number is 351-4441, and the representative there is Nancy Peters, and you can always ask for her. I want to thank our public for watching us today on Choices to Benefit the Aging. If you have any questions, please, regarding your hospice benefit, you may call me, Joe Urrutia, at 533-0999, or you may call Robert Vasquez for your home health benefit for rehab services and skilled nursing at 544-0044. I would like for our public to please look for our weekly program on your Southwest Senior, on our topics that we have on a weekly basis. Again, God bless you, and thank you for watching us today on Choices to Benefit the Aging. Thank you.
Choices to Benefit the Aging has been brought to you by Choice Home Care and Hospice. For more information on this program, go to El Paso Southwest Senior Magazine at www.southwestsenior.com. Furniture provided by Copenhagen, 6550 North Mesa.